Well, welcome everybody. We'll go ahead and get started to respect your time. I hope everybody had a great, healthy, and safe Labor Day weekend. We were hesitant to start this on the Tuesday after a 3-day break, but great to see so many friendly faces. We are recording this, and everything will be posted to our website, vitalysthealth.org. Um, but my name is David Martinez. I'm a director at Vitalyst Health Foundation, overseeing our grants and partnership program and team, as well as our civic health priority area that I'll dive into a bit more in depth for this. I'm also joined by my colleague Erica Foster, who will be monitoring the Zoom room where you can put your questions, and then we'll have a live Q&A at the end of the presentation as well. But this is our monthly Spark Partnership webinar that provides an introduction to folks across our great state 48 that may not be familiar with Vitalyst Health Foundation. And we use it as a way to introduce you all to both our grant making efforts and our programmatic priority areas so that you can determine if your entity, your effort is aligned with Vitalyst efforts, and then explore, discover partnership with us through the channels that, again, we'll discuss more in depth. Um, this is definitely a safe place, but we are you're welcome to take yourself to keep yourself on off video if that's what you prefer. But again, if you have any questions about the slides, go ahead and put them into the chat room. If you need assistance in Spanish, we can have those conversations with our bilingual staff members. Just email conversemos@vitalysthealth.org. We have other accessibility functions set up. We do have everyone muted upon entering the webinar, but as I mentioned, we'll have an open Q&A at the end, and please definitely use the chat to ask questions throughout the session. The slides, more information in this recording will be posted to our Partnering with Vitalyst webpage at vitalysthealth.org. So Vitalyst is on a mission. We have a strong vision and mission here in the state of Arizona. We're based in Phoenix, but we have partnerships across Arizona. And we hold an equity lens in all of our work. So we are especially building and deepening relationships in rural, tribal, and borderland communities for communities and populations that we know have the greatest health disparities in Arizona. But we really do want all individuals and communities in Arizona to be healthy and resilient. And we do that as a focus with our mission to connect, support, and inform efforts that improve the health of individuals and communities in Arizona. That connect, support, and inform is really important to us because we definitely see ourselves as connectors, as catalyst for super awesome concepts that are happening across the state that improve health. And we are a foundation, so we do leverage support in a lot of different ways, including grant making. And then we are a public foundation as well, so we do a lot of efforts to inform, especially decision makers, on our top priorities and do a lot of advocacy and public policy. We are a health foundation, but we see health as more than just health care. We look at the broader social determinants of health, or as we call it, the elements of a healthy community. Have folks seen this wheel visual before? It's been around for about a decade plus years that reflect really just the intersectionality of health. So we definitely see access to care as a key pivotal element of a healthy community, especially now with the pending Medicaid cuts that are coming down the pike through our state Medicaid system here in Arizona called Access and Kids Care for Child Health Insurance. But we do a lot of, we kind of look to this wheel to determine if your effort or entity is mission aligned. So we have a pretty broad portfolio. We can find alignment with most any entity, but there are some parameters that we have established, especially for our priority areas and our grant making portfolio that we'll review in just a little bit. The mission, as I mentioned, is to connect, support, and inform, and we do that through our three goals. Vitalyst works in an upstream mechanism, which, if you've worked in the public health space, is something you've probably heard of. But for those that don't, it means that we want to take an upstream approach to intervention, supporting and improving health in Arizona that really tackles the root causes of the greatest health disparities in Arizona, as opposed to like a downstream intervention, which are still very, very important, but address the more short-term programmatic or direct service needs of those interventions or solutions. I used to work in food banking, so I often give this example. The concept of distributing emergency food boxes, that is that more downstream intervention. Again, very important work because people are going hungry and experiencing hunger and food insecurity today and need that critical sustenance. But we're trying to support efforts that are upstream and asking, why are people going to the food bank in the first place? And looking at the more systemic thinking and systemic problem that exists with that issue in the first place. That is really heavy work, and it means that we have to work in collaboration and coalition. So that is really our first goal, supporting collaborative networks working to improve the conditions that impact health. But we also recognize that those collaboratives, those coalitions are made up of individual partners that also need to be strong themselves, especially to ensure that they're equipped to advance health equity. So our second goal is really focused on strengthening community partners in those areas as well. And then, as I mentioned, these upstream interventions are really tackling systems change, systemic problems, and that often involves some sort of policy or systems change, which means we do a lot of advocacy and public policy and support entities who are engaging in those efforts that inform decision makers as well. I like to say Vitalyst has kind of two sides of the house. On one side, we are a foundation, so that's our grant making side, and you'll learn more about that in just a few slides. But on the other side of a house, we operate a little bit differently than a lot of foundations in that we have programmatic priority areas where we have staff members who have expertise, backgrounds, know-how on key priorities for the states. We look at and explore what are those priorities, what are those greatest health disparities in Arizona that we both have, that we have both staff support for, experience, knowledge, etc., but also that is a critical need for Arizonans' ability to live healthier. So those programmatic priorities are civic health, healthcare integration, and housing. And each of those priority areas are overseen by a different director at Vitalyst Health Foundation. So I direct, in addition to our grants program, our civic health portfolio. And in each of these portfolio areas, we have activities and strategies that encompass each of those three goals of collaborative networks, strong community partners, and informing decision makers. So in our civic health portfolio, this is really the concept that the more civic engagement, the more civic participation, the greater community connectedness people have in their communities, the healthier they are, the healthier those communities are. And we think that the healthier our state and our country and our democracy is. So we look at those, again, systemic issues in civic health that either enable or inhibit a person's ability to engage in their community, to tackle their toughest challenges, to solve their community challenges, but also engage in government as well, because again, sometimes you have to take that approach for systems thinking. So for instance, in our civic health work, we support a collaborative network called One Arizona, which is a coalition of about 30 grassroots community-based organizations that are building and deepening relationships in communities to then mobilize those and build power within those communities to activate for things like voting, completing the census, and ensuring that our legislative and congressional districts are fair and independent. And if you're watching the news, you see how important this concept of redistricting is now, because some states are attempting to redraw their lines in the mid-decade. Usually it only happens in years that end in zero, so like 2020, 2030, et cetera. We also do a lot in our civic health work around supporting specific community partners, especially those that are helping build the capacity of those coalitions and those partners within those coalitions. And then a lot of informing decision makers. I've been down at the Capitol this past session working on legislation around the census and redistricting and voting access, of course, which has been a really hot topic here in Arizona. My colleague Anna Rossetti, whose beautiful face is next to my ugly mug there, oversees our healthcare integration work. This again really focuses on the integration of healthcare as more than, or as health as more than just healthcare, looking at how the physical, mental, and social determinants of health all intersect. Still, of course, access to care is a big piece of this, especially again, as I mentioned, with the Medicaid cuts coming down the pike. So in this instance, Anna works really closely with a collaborative network called Cover Arizona Coalition, which has a network of navigators to help Arizonans navigate our healthcare systems. Once we do have open enrollment for the Affordable Care Act, since we are a Medicaid expansion state, and then the marketplace and private insurance as well. She works also collaboratively to strengthen community partners that are part of that network, like community health centers, especially in rural and tribal areas that will be hit hard because of those Medicaid cuts, and other resources and community partners that need to be strengthened as part of that network, like Arizona 211 and other partners like that. She also leads our state health advocacy. We have a public policy committee of our board, so Vitalyst takes stances on a variety of policies at the state capitol that really intersect with our health care integration portfolio. And then the fella next to Anna is Gabriel Jaramillo, who oversees our housing work. In this instance, he specifically works with the Arizona Housing Coalition, again, that collaborative network that really is looking at the spectrum of housing, from houselessness to housing affordability. He's working specifically to strengthen community partners that are deploying promising practices to help meet especially workforce affordable housing throughout Arizona. So there are some really cool projects happening with school districts where schools are leveraging their property and we're connecting them with nonprofit housing, affordable housing developers to help build workforce housing for schools so that they could recruit and retain teachers and have them be able to live in the district that they're working in. And other institutions like churches, community health centers, colleges to utilize their vacant land so that more affordable housing can be built throughout our state. There's a lot of policy work that Gabe also works on to ensure that those zoning policies and any state policies that impact housing have a strong voice at too. And then the last fella on that page is our Director of Strategic Communications, Sergio Perez. He doesn't have a specific portfolio area as a priority. However, he helps us communicate all of those things, including our work with our partner. And as we'll talk in a little bit, our discovery process that we use to discover new partnerships. If we have any partners that are working specifically in the educational system or food systems, Sergio facilitates those conversations and builds those relationships because he has background and experience working in those areas, though they are not key priorities for Vitalyst. So if you're thinking, okay, I'm doing work in one of these areas and you want to explore more about what each of that work really looks like, we would connect you with one of our directors and they can have a conversation. These are our more non-competitive programmatic grant opportunities, but that funding is really leveraged by the strategies that each of our directors working with those community partners outline for the year. And it's not really a responsive grant making program. It really is to support those coalitions, those specific community partners in those spaces, and then our advocacy efforts in that work. This is also where We leverage a lot of our convening support, facilitation, research, data collection, and as I mentioned, a lot of advocacy and public policy. You do not have to be working in these priorities in order to partner with Vitalyst on the grant side. And that's what we'll get into a little bit. So as I mentioned, Vitalyst, as I say, has two sides of our house. One side are those more programmatic priority areas, and then the other side of our house is our responsive grant making program. That responsive grant making program is a three-tiered grants program meant to help support coalitions working towards systems change. But it really, the type of grant you might align with depends on where you're at in your journey towards that systems change, where the coalition is at in their journey towards systems change. So the first tier is our technical assistance grants, and then it would jump up to the Spark grant, and then the third tier is the systems change grant. And I'll take a deeper dive into each one of these criteria so that you could better learn about and understand where if it might be alignment with your coalition and collaborative efforts. In total, this is a 5-year grant potential for up to $225,000, again, meant for coalitions working to implement some sort of systems change. We have an open door policy at Vitalyst Health Foundation. So if you go to vitalysthealth.org after learning more about how we operate and you might see alignment, you can go to our website and complete our discovery intake form, which is essentially like an initial eligibility quiz or an initial intake form, an interest form that we use to help facilitate and build those relationships with partners. It is an online form, but if you give us a ring, if you're having challenges with technology or whatever support you need on that front, just give us a ring and we can help you walk through that form as well. It should take you about 8 to 10 minutes to complete. It's a pretty quick form. And then once we receive it, we will review it to see if there is indeed alignment with one of our grant opportunities, or if it's a more introductory conversation, we'll have folks listening into this webinar initially and then determine if there is alignment with one of our grant types. If that is, if there is alignment, then you'll receive an email prompt to schedule a time to chat with one of those directors that I mentioned in the previous slide. And who you're talked to depends on what the effort is you're working on based on our own portfolio areas. So for instance, as I mentioned, our colleague Sergio, he has background both in the educational system and in food systems. So if your effort is working in that space, you'd have a conversation, an initial conversation with Sergio. If your effort is around housing or any consideration of like healthy communities, then my colleague Gabriel there. So now let's take a deeper dive into each one of these three grant types. The technical assistance grants, as I mentioned, is the first tier of our grants program. That is meant for coalition capacity building. So if you and a single entity or a group of partners have come together to think through, we need a coalition to address this systemic issue. We want to work towards systems change. The technical assistance grants would be the lane that you fall under. So you'll note the criteria for each of our grants are the same 5 points. Again, it just depends on where you're at in your journey towards that systems change. So that first criteria is on coalitions. Your coalition at this point doesn't have to be completely formed because the technical assistance grant, again, is meant to be that capacity building for your coalition to allow you the space and grace to form up the coalition, build that trust needed. If anybody has worked in coalitions, you know it could be challenging. Those relationships are really, really critical. That trust is really critical. Maybe you need help kind of facilitating those initial conversations with your coalition, or even identifying who needs to be in part of your coalition so that each one of your coalition partners has a really strategic role and responsibility as you work towards your bigger systems change. The effort still has to work to improve some sort of health outcome. As we mentioned, we utilize the wheel visual to help folks think through how can you frame your health outcome. Though this is really focused on coalition capacity building, it's not just to build coalitions for coalition's sake. It is really meant to support coalitions working towards some sort of systems change. So that's that third aspect. You don't have to have the solution identified per se. You just have to address kind of the system that needs to be changed. So for instance, if you're, again, I'll give a food example in this conversation that you may have with Sergio. You might have this kind of concept of alleviating hunger in your community. That would be the larger food system. And then the ideas and the specific interventions or solutions would then come after later on in your journey towards systems change. We hold a health equity lens in all of our work here at Vitalyst, including through our grants program. So this is a really important aspect of our grants criteria. For you all, this could look like a lot of different things. First, definitely those closest to the problem should be closest to the solution. So we want to see coalitions engage community members with lived experience on the health issue and health outcome you're hoping to improve. And um, so including those voices at the early stages of your coalition phase and then throughout your journey. This could also look like the utilization of disaggregated data, especially as it's connected with the health outcome. So for instance, if you're hoping to improve diabetes in Arizona, you can hold a health equity lens in that in looking at the data that shows that certain communities or populations have the higher diabetes rates in Arizona. So we would look at how specific you get on that front. And then each of the grants has a criteria around the budget, has to be consistent with the proposed scope of work. In this instance, the technical assistance grants is for up to $20,000 and for up to 1 year. We use the up to amount and we really stress those things because it really depends on what your specific capacity building need is, what is a specific technical assistance support that's needed for this coalition. And that might mean it's a smaller grant amount and it's a smaller time frame. So for instance, grants have been leveraged to cover the compensation of a facilitator to help bring groups together and have those initial conversations about what it would mean to build up a coalition to address systems change. That might be done over like a 3-month time period. So it would be less than $20,000 and less than a year. And you might need additional support coming out of that, but the grant could be as specific as that. The technical assistance grant, like our other grants, are reviewed through our discovery intake form. So if this is the grant you find greatest alignment with, just go to vitalysthealth.org, complete that discovery intake form. And then once we receive it and review it, you may receive an email prompt to schedule a time to chat with the Vitalyst director. We used the tool Calendly to do that. Those initial conversations are usually around 30 or so minutes, where that director will have your intake form, just get a better understanding of your efforts and to look for alignment against the grant's criteria. And if they determine that, yeah, this is aligned as a technical assistance grant opportunity, they would invite you to submit a formal proposal or application through our new grants management system or GMS called Akoya Go. And that application will look generally about 2 pages long with, again, a budget that reflects an amount up to $20,000 and reflective of the proposed scope of work. And then once the form or the application is submitted, we go through an internal review process made up of team members here at Vitalyst to review the application, the budget, and reach consensus on whether to fund it or not if it's aligned with those grants criteria. And then once we reach consensus to fund, go into the formal partnership and complete a grant, or in this instance, we often work contract directly with the consultant that the partner has selected, depending on what you want to do on that front. Um, these do not have to go to our board for approval. So we have that internal review process and review these throughout the year through our discovery intake form, and then we award throughout the year so far as we have budget capacity. So there is no specific grant cycle for this. We simply go through our internal review process, and as those applications come through, we usually have the internal review process. It's all online, and then we have a meeting that we can schedule every Monday. So it's a pretty quick turnaround if that is the case. The next tier from the technical assistance grants is our Spark grant. So after the coalition has been built, the capacity of that coalition has been built, and your collaborative is ready to plan your systems change, that would be the Spark grant. So the Spark grant you can see as a more of a planning grant. Again, the same 5 criteria pieces, but this you can see kind of the move in your journey. So at this point, the coalition should have been convened. It's a coalition, so it has to be more than one partner. We really look at quality over quantity when it comes to coalition. So it really is, do you have the right partners at the table with specific roles and responsibilities that will help you plan and implement your systems change? Your health outcome should be more clarified from this aspect of it, really looking at, again, the will to help your health outcome. And then in this piece, the systems change criteria, you are just a little bit further in your advancements, really thinking through and planning out what your interventions and solutions are towards systems change. So you are getting a bit more clear picture with the system to be changed and the activities and strategies you have to plan for that change. The health equity lens again is in here as well. You should still be continuing to engage those community members with lived experience, and being a bit more specific using disaggregated data for the health outcomes to be improved. And then in this Spark grant, it's a 1-year grant of $25,000 whose budget should be consistent with the proposed scope of work. Very similarly to the technical assistance grants, we use our discovery intake form to review these opportunities as well. So just go to vitalysthealth.org if you find alignment with the Spark grants. Again, the more planning grant for coalitions planning systems change. Complete the discovery form online. We'll receive and review it. And then you may receive email prompt to schedule a time to chat with the director. As those directors are having that conversation with you, when they determine that you are aligned with the Spark grant, you'll be invited to submit an application through through Akoya Go, our grants management system. And then these do have to be approved by our board. So we have a fall grant cycle and a spring grant cycle that are attached to our grants committee of our board. So the fall deadline is on October 9th, and then the spring deadline is May 7th. So again, we'll still have these conversations throughout the year, but we'll tee you up for those grants, those grant cycles for review and review of your applications by Vitalyst team as well as our board committee. So once you have built your coalition, you've done your planning towards systems change, now you're ready to implement your systems change. That's the systems change grant. It is the implementation grant. So this is again, the same 5 criteria, but this grant is the larger 3-year grant of up to $175,000. So we have a more thorough and vetted criteria as part of this. So it's still the same 5 grant criteria, systems change grant, or the effort has to be focused on systems change. It has to be a collaborative or coalition. You have to be working to improve a specific health outcome, especially tied to the will, with a health equity lens and a budget that matches the proposed scope of work. But again, this is the journey of this coalition is at the implementation phase. So you should be really clear on the solution and interventions towards systems change. You just need multi-year funding and time to implement it. Your coalition and your collaborative is strong. You're ready to implement this. There are strong trust and relationships. Specific roles and responsibilities have been outlined and whatnot. Your health outcome has been clearly identified, and there is a health equity lens in that work. Of course, still continue to engage those closest to the problem as closest to the solution. And then the budget, of course, is a 1-year grant of up to, or excuse me, a 3-year grant of $175,000 and a budget narrative to match that proposed scope of work. For the system change grant, we highly recommend folks go through the discovery intake form to really explore if this is a grant fit for you all. However, we have set up the system change grant also as an open application. So our portal is now open, and we are hosting an information session next September the 9th. And the deadline for this is October the 9th. This is a grant that also has to go to our board for approval. And because it's a much more thorough process, we have this on an annual grant cycle. So this grant cycle is open now and it closes October 9th for a 3-year grant cycle. We again really encourage you to go through the discovery intake process to really determine if there is alignment with our grant criteria. So you can go complete that form, and once again, we will receive it and review it, and you'll be prompted to schedule via Calendly with one of our directors. And then if there is alignment, or even if you opt to submit directly through our portal, it's an application that's 5 pages, including a budget and a template that we have. After the October 9th deadline, our team begins our review process, which includes an initial review of a smaller subset of my team that essentially ensures that the basic eligibility and criteria are met. And then from those, we advance those applications that have met those minimum qualifications for our team review, which includes that grant committee of our board. We use an evaluation rubric that is something new that we have this year that is now open and public on our vitalysthealth.org website, vitalysthealth.org website. So we call it an open book test. So you see the exact same questions and in the criteria, the 5 criteria points that our grant review teams are looking at that are that to make sure that they're answered in your application. So long as you answer those questions in the evaluation rubric to the best of your ability, the stronger your application will be. There's a scoring system that we follow with our 5 criteria pieces, and based on those scores, then have a conversation on which to advance as within our grants process. And those that we invite to advance forward are invited to present their systems change proposal in a 30-minute virtual meeting setting to that grant review team. Once those are all complete, our grant review team does another evaluation using that rubric to come up with a second set of scores for that proposal. And then from there, we combine the 2 scores of both the written application and the presentation. The written application and the presentation. We do this to hold an equity lens in our grant making process, because a lot of the applicants that we receive may come from grassroots community-based organizations that don't have a full-time fundraiser or grant writer. So the presentation piece of it is their ability to tell their story themselves without kind of having to rely on that added capacity need of a grant writer or fundraiser. But the application and the presentation are the two steps of this process. And then once we compile the scores, our team reviews them and then selects the four that will be funded. So for the systems change grant, we have funding for 4 grant partners this year. And then this has to be approved by our board. So we advance them to our board as well. Yeah, the follow-up, and actually on vitalysthealth.org's Vitalyst partnership webpage, the registration link for the info session is already posted. So if you want to go learn more about the systems change grant, you can register for that. We'll take a much deeper dive into each of the 5 grant criteria and the process at that info session. So that is a bit more about Vitalyst, both our programmatic side of the house, as well as our grant making side of the house. It's meant to provide just this kind of introductory this introduction to Vitalyst for those that may not have learned about Vitalyst yet. And with that, we can open up to Q&A. So Erica, can you help me navigate those ones that were posted to the Zoom room, and then we can open it up for live Q&A as folks have them.
Yeah, we just got 2 questions as you were closing up, and so I can read those. And so we have a question from Brianna. It says, has an organization ever received funding for a systems change grant for one project and a technical or Spark grant for a separate project in the same year? And so if so, like, how would you suggest them to fill out the intake form if they feel they have one project that fits into systems change and one project that fits into technical or Spark, and want to discern which project Vitalyst is more interested in?
Yeah, we have not had that situation, but we are open to it. I will say there will be kind of a heightened review of that lead applicant's ability and capacity to take on being the lead for to multiple coalition efforts. Coalition work is hard, and the lead applicant is really taking that pivotal role with kind of building up the coalition, planning the system change work, and then implementing the system change work. So it would be a really unique situation, especially if it's a smaller entity or organization. If it's a larger institution like colleges or universities, like we'll get multiple applications from like the University of Arizona from different colleges or departments. So that's a bit of a different kind of situation. But if you're really a smaller entity or organization, we really do kind of want to see if you have that capacity. And also determine if you are the best lead applicant for the other concept, because it might be better if another entity is a lead applicant while you can still be really active in that coalition effort. So it's not a no, but it's we can have a deeper conversation to determine if that's the case. I did also want to cover something that I missed. While we have 3 tiers of our grants program, you don't have to start from square one. If your coalition is built and you're ready to do your planning, you can jump straight to the Spark grant. Or if your coalition is built, you've done your planning, you're ready to implement, you could jump straight to the systems change grant. You don't have to start at the technical assistance grant level.
Thank you.
Yeah, thank you, Brianna.
Awesome. And then our next question is, what is the appropriate length for the intake form questions? Want to provide as much detail as possible, but not overwhelm you.
Yeah, great question. I'm not sure if we have actually filled limits within the discovery intake form, but it really is supposed to be kind of like if it's taking you more than 10 minutes to complete, your answers are too long. We need just enough information to have that initial conversation and kind of get a sense of could this be aligned or not. So I wouldn't say begin writing the actual application and how your effort aligns with the 5 criteria pieces, but talk about kind of the broader aspects of what system are you really working in? What is the health outcome you're trying to improve? Um, who are your coalition partners or your potential coalition partners? You don't even have to take a deeper dive into kind of what their specific roles and responsibilities are yet. Um, how are you working in and holding a health equity lens and all of that stuff? So the it doesn't have to be too long. And I don't think we set up specific character limits on those fields because we didn't want to be too restrictive in that early stage.
And our next question is, can multiple TA grants be awarded?
What was that?
Can multiple TA grants be awarded?
I'm assuming it's like maybe to one individual partner or the lead applicant, and it would be sort of the same kind of answer to the previous question on accepting multiple grants. Um, if it one technical assistance grants per effort, I guess I would say. So if an organization has many efforts, they may qualify for multiple technical assistance grants. But again, we would really look to see can that lead applicant, the lead organization, take on building the capacity of a lot of different coalitions and whatnot. So I would really look to that organizational capacity concept. Um, but if there are multiple efforts led by the same applicant, we really kind of have those conversations and again determine how you work through if having that entity be the lead applicant for multiple technical assistance grants is the right concepts. Also, the technical assistance grants really are meant to be really specific to address a specific capacity building and technical assistance needs. And we know that, coalition might need a lot of those capacity building issues, and your scope of work could address multiple technical assistance needs. It just doesn't have to be that too specific. So if you need both facilitation and kind of trust building activities and resources for multiple convenings up to the year, then write it in your proposed scope of work, and we might determine with you which are actually capacity building and which are more of like moving into the planning phases or whatnot. So we try to have this kind of open dialogue to really determine what are those capacity building needs of your coalition and then help you address them and then kind of right size, I guess your proposal would be the way so that it's doable, especially in the time frame that we're talking about.
This next question, I think you've covered some of it, but I'll still read it just in case there's anything else you want to touch on for this. And so is there a cap on how many submissions can come from one institution for the systems change grant?
There is not. It would be very similar to the previous answer. If your organization is leading multiple systems change efforts and leading multiple coalitions, we would again really look at the organizational capacity. We have not had a situation in the nearly 10 years we've had the System Change Grants program that we've had the same organization secure more than one grant type.
And then it says, can you please go over any of the changes to the assessment or priorities since the discovery form was updated? They're specifically interested in the TA grants.
Yeah, the very similar to how we have an evaluation rubric for the systems change grant, we're creating a similar rubric for the technical assistance grant and the Spark grant, just so our partners, as I mentioned, have kind of like this open book test concept. So you know exactly what we're asking. We're still developing those, and to be clear, and those will be posted. But it's the same 5 grant criteria that we've outlined here. We're just hoping to have a bit more clarity with our partners about those specific points that we want to ensure are covered in each of the criteria areas.
The next person wants to know, what is the minimum number of collaborators, and can it be one service provider delivering a program to one agency, specifically also for a technical assistance grant?
Yeah, so the technical assistance grants can be one entity who is then forming a coalition utilizing the technical assistance grant. So that is the only grant type where one entity is allowed. It could be it has to be either a 501(c)(3) nonprofit serving Arizona or a fiscally sponsored organization. But the whole idea is to build up your coalition. For the Spark grant and the Systems Change grant, you will need for sure more than one partner. It's meant to be a collaborative and a coalition. And again, we don't really look at the quantity per se, we look at the quality. We at least want you to have two partners, but even two partners is a very minimal amount as part of your coalition work. We really are looking at, okay, what is the system you're trying to change, and who are those partners that will make that happen? And the that number really depends on, okay, what are the specific role and responsibilities that they have to help change that system? Systems change is really hard work. And if you're relying just on two organizations, you're probably not going to score really well on that coalition criteria, because it really does take a village. And when you're trying to tackle things like policy change, for instance, if you don't have an entity that is a key driver of policy that impacts your system that you're working in, and that has like relationships at the Capitol or that can help you do actually advocacy and public policy work, then your coalition probably isn't as big as it needs to be. We did have one instance where we reviewed a technical assistance grants partner who was trying to tackle policy change at the state level, but were not engaging any of the key, in this case, they were working in the educational system. They weren't engaging any of those key stakeholders or partners. So they really were scored lower in that criteria. So we said, work on building those kind of partnerships and then come back and we might explore the funding opportunity.
Okay, this one is a little longer. It says, do we have to decide ourselves which level we are at already in the discovery form, or will you tell us which level fits our idea if you're interested? And then they go on to say that we think we are at Spark level already, but maybe we should start at technical assistance.
Yeah, on the discovery intake form, you do have to select, which one you think you might be aligned with. But as you're in conversation with the director, they might think, oh, you're actually better suited for the technical assistance grants. Or maybe you're far enough in part of your work to apply for the Spark or Systems Change grant directly. So they will help you walk through that. If the director says, okay, I think you might be, I'm going to invite you to apply for the Spark grant. That's where I think you're aligned with. And then in that review process, that review team might be like, well, actually, some of these components are actually more so technical assistance grants, or what they're talking about isn't planning, it's implementation. We're going to bump you up to the systems change grant process. Then we would kind of have those conversations back with you.
And sorry, I missed the second part. It was basically if they're funded at one level, can they move to the next next level next year?
Yeah, that's the whole concept. You still have to go through the application process for the next grant type, but it really is to help deepen relationships with our partners. And again, there's a 5-year potential. That was direct feedback from our partners saying, the focus on the 3-year grant, we really appreciate it, but we needed way more time than 3 years to help not even just implement our systems change, but make strong advancements in our systems change. So that's why we put in the Spark grant and now the technical assistance grant as the 2 tiers before then. So now we have a 5-year grant potential. So the idea is if you're coming in at the technical assistance grant, yes, we want to help you build up that coalition to then position you even more strongly for the Spark grant. It's not a for sure slam dunk. You have to still submit the application and ensure that your coalition is at that phase of planning, and then subsequently for the systems change grant. So the whole idea is to help you go through all 3 grant types, but it's you still have to go through the application process.
And then we have 2 more questions. I was just responding, but I'll put it to the group. So just a confirmation that the grants are for 501(c)(3)s only, which is correct. And then related to this, it says for the TA grant, can the fiscal sponsor be TAP AZ?
Mhm. So the funds are meant for 501(c)(3) public charity efforts in Arizona, or you can have a fiscally sponsored, have a fiscal sponsor. However, we can grant in many instances to other entities that are nonprofits, like government entities. We have in the past provided grants to county departments, state agencies, et cetera, that are working on specific issues, like the Maricopa County Department of Public Health or the Pima County Attorney's Office, entities like that that are still nonprofit. Or, especially for the technical assistance grants, while the lead applicant does have to be kind of those nonprofit at C3 entities or fiscally sponsored groups, the grant can be leveraged as a contract. So instead of providing that lead applicant with the grant, Vitalyst can contract on behalf of the partner with oftentimes a consultant that is helping build up the capacity of a coalition. And we do that, we have that as an option, and we've done that in the past because that lead applicant may not have the capacity to manage that contract or the payments or all of that good stuff. But really, the partnership is still between the consultant and the group. It's just Vitalyst contracting directly with the consultant. For the SPAR grant and the systems change grant, we've never seen that happen. It really is a lead applicant that is a C3 nonprofit or fiscally sponsored organization or a recognized nonprofit like a government entity. We certainly have in the past had groups that were fiscally sponsored under TAP AZ. And for those who don't know, TAP AZ is our fiscal sponsorship program here at Vitalyst Health Foundation. TAP AZ stands for the Technical Assistance Partnership of Arizona. We have about 60 or so projects that are fiscally sponsored by TAP AZ. This is, I said we have kind of two sides of our house. This is actually the third side of our house because it's a whole other entity that has its whole other application process if groups are interested in exploring fiscal sponsorship. If you go to tapaz.org, you can learn more about that fiscal sponsorship and the different types of fiscal sponsorship. So in many instances, we have groups that come under our 501(c)(3) status so that they could accept charitable contributions, tax-deductible charitable contributions. But we have other types of fiscal sponsorship for groups that may have their own 501(c)(3) status. They just essentially outsource their back office financing and accounting to us through fiscal agency, or they outsource the management of a specific grant, and that's the grant-specific type of fiscal sponsorship. So they have their own C3 status. They just work with and utilize TAP AZ to do that back office financing and accounting for us. Our TAP AZ team also hosts monthly one-on-one sessions like this, and those are posted at tapaz.org if you want to learn more about TAP AZ.
Awesome. And then we have one more question that says, can we have two strong lead collaborators and then several more that will be part of the conversations around systems change? So it would be more so that the two lead organizations are convening the discussions.
Yeah, totally. Yeah. So once you complete the discovery intake form, and you'll receive that prompt to schedule a time with one of the directors, you'll see all the options that we have for the conversations. Pick a time that works for you and your partners, and we can certainly have them part of the conversation, share the calendar invite with them as well. And you could easily forward it as well. It comes up as like a Outlook calendar invite.
Awesome. That's everything from the chat. Is there anyone else with other questions?
Yeah. I'll also note that while there has to be a lead applicant and the funds go to that one partner, that lead applicant can then sub-grant out to other core partner coalition partners, and certainly subcontract with other like consultants that they might engage with. We just write one check essentially to one applicant, and then you can bake into your budget and then, of course, provide a narrative of to ensure that the scope of work matches that budget request. But we actually highly recommend that because, again, coalition work is hard. It's an equitable practice in grant making and coalition building to compensate folks for their time, including those with lived experience. And then your core partners, and that is determined, you basically determine that, but we definitely kind of have that as part of our criteria. And as you see on the evaluation rubric for the system change grant, it's a specific point within that coalition partner. I know we're coming up on time. I see, Brianna, you have another question here on where our funds are coming from. Great question. So Vitalyst Health Foundation used to be the St. Luke's Hospital system here in Phoenix. So if you are from the Valley, you're probably familiar with the St. Luke's Hospital downtown and then the one in Tempe. Those used to be nonprofit hospitals that were under the St. Luke's Health System. And then in the mid 90s, that it sold to a for-profit company that runs them now, separate from Vitalyst. So with the sale, the foundation and endowment of the hospital and the sale formed our endowment, which is now managed, that we now managed. So Vitalyst House Foundation has an endowment of about $140 million that is invested in the markets and in other investment opportunities. And we have an investment policy that our board manages, as well as a spending policy that the board has set that allows us to withdraw from that endowment a specific amount of funds that we then use for our grant making, for our programmatic priority areas, for our administrative and operations cost. And that's where our funding has come from. So as a foundation, we don't do fundraising. We simply rely on that endowment for the funds that we then grant out to communities.
Thank you.
Yeah. Is it similar to a block pass-through grant, or are these funds coming from private foundations, corporate foundations? Yeah, so we're our own foundation. We are a public foundation because we have TAP AZ as that 501c3 status. So we operate a bit differently than most private foundations and corporate foundations. And that's what allows us to do a lot of this advocacy and public policy work, because as a public nonprofit, as a public foundation, we can do that work.
And
Thank
then
you
we
so
have
much.
one more question that says, are not-for-profits eligible?
Oh gosh. We have explored those opportunities, especially at the technical assistance grant level. But the work really does have to be in that public charity space. I'm trying to think of an example. I can't think of an example when the lead applicant was a for-profit entity. But we have explored that because it really is meant as like a that partner might be the best lead applicant. The closest thing that we've come to this is like if that entity is like a consultant, they're technically like a for-profit entity. So I think bigger picture, I think the question is, are not-for-profits eligible? Yes. I think I read that as are for-profits eligible. But not-for-profits are eligible, yes. Okay, we've gone just past the hour. We've gone through all the questions. If you have any other further questions, don't hesitate to reach out to us. Again, go to vitalysthealth.org to learn more about the specific grant types. And if you see alignment, complete that discovery intake form, and we can further address any additional questions you have. Thank you all so much for your time today. We'll be sending out this recording and the materials in a follow-up email to those that registered. And if you would like to register for our September 9th information session to specifically talk about the systems change grant, we invite you to do that as well. Thank you all so much for your time today.